Hi, everyone. Welcome to the State of Early Learning today, Tuesday, January 26, 2021. I am Jennifer Ehrbacher, and I'm here today on behalf of Early Learning Indiana to welcome you and introduce to you Maureen Weber, President and CEO of Early Learning Indiana. Before we begin, just a couple of logistical details we want to cover. Everyone on this webinar is muted to ensure the best audio quality for all of our participants today. If you have a question, there is a questions box on the side panel of your screen. Please feel free to drop any questions or comments as we go into that questions box, and we will answer those or address those in the second portion of our event today during our question and answer session. We are recording today's event, and we will email a recording link out to all of you this week. That recording will also be posted on Early Learning Indiana's website, which is earlylearningin.org. It is now my pleasure to introduce to you today Early Learning Indiana President and Chief Executive Officer Maureen Weber. At Early Learning Indiana, Maureen leads a team that is relentlessly focused on three main things: transforming the early learning industry by addressing systemic barriers to accessible, affordable, and high-quality early education, sharing expertise to build system capacity and improve learning outcomes, and operating a network of community-based lab schools that help to advance the science of early education, invest in a new generation of teaching, and instill essential skills in children. Maureen brings to this work 20 years of experience in organizational strategy and execution, working across sectors to improve the way organizations meet the needs of the individuals they serve. And so I will now turn it over to Maureen.
Thanks so much, Jen. And on behalf of the board and the team at Early Learning Indiana, it's my pleasure to welcome you all here this morning as we share our perspective on the health of the early learning industry and suggest a few recommendations for the road ahead. We know that we're joined today by longtime members of our Day Nursery Auxiliary and other champions of our work as an early learning provider, by community leaders anxious like we are to understand the current state of this linchpin service sector, and by providers who we are proud to work alongside for the benefit of our state's youngest children. We're grateful to all of you for your interest, whatever brings you here today. We recognize that what we'll share is simply one organization's view, and we're anxious for the discussion that will follow with each of you moving forward. After years of new public and private investment, early learning is at a crossroads in Indiana. Across communities, many more stakeholders understand the value of the first years, and many more providers are committed to delivering the type of quality learning experiences necessary to capitalize on it. Notwithstanding this understanding and that commitment, there remains a sizable misalignment between best intentions and resulting actions. Over the past year, Hoosier families' need for safe and high quality early care and education has been clearer than ever before. The COVID pandemic has kept young children from foundational skill building opportunities and separated families from the reliable care that facilitates their self-sufficiency. Moreover, the lengthy outbreak has profoundly destabilized the early care and education system, threatening the viability of this sector whose sustainability is critical to the post-pandemic world that is now within sight for all of us. Yet these unprecedented times carry equal measures of risk and possibility. While we have faced these challenges, policymakers, families, corporations, and others have become ever more clear-eyed about the importance of our collective work. So as we gather here today, it's our belief that the state of early learning is essential. Our economy cannot fully recover without it, but it's also fragile. The already precarious sector has certainly been made more so by recent events. That said, we know that it's full of opportunity. Perhaps never have we been more aligned around the need for dramatic public and private sector action to achieve our aims. We'll spend just a few minutes today talking about the first two, with the balance of our time focused on the third, the opportunity that awaits us if we are able to move forward with a shared vision and purpose. It's hard to believe that it wasn't that long ago that phrases like social distancing were entirely unknown to us. And if you're like me, you might some days wish that they still were. Back in those far gone days, as we thought about the health of the sector, we worried, as we still do, about families' ability to access care, the quality of the care that they would find, and whether those learning experiences were affordable for them. Without delving into the data that is familiar to so many of us, what was clear is that in many parts of Indiana, families struggled to both locate and afford high quality care. Even as we've made tremendous progress in recent years in growing the overall supply of early learning opportunities and expanding the number of high quality providers, one need only put yourself in the shoes of a middle income parent of an infant or a toddler seeking care to know that our work was far from complete. At the height of Indiana's stay-at-home order in the spring of 2020, as many as 1/3 of all early learning providers temporarily closed in response to the pandemic. Providers remaining open, including our own day early learning centers, made rapid changes to adapt their practices to the new reality in order to serve healthcare providers and other essential workers. Providers like us leaned on old friends for new partnerships with members of our day nursery auxiliary sewing hundreds of child-sized masks before they were widely commercially available, and experts from IU Health informing our health and safety practices as we created unique care offerings to serve the children of their team members responding to the pandemic. Happily, by early December, only about 50 providers statewide had permanently closed their doors. However, in a November survey, approximately 20% of providers indicated that they were likely to permanently close in the future, and an additional quarter were simply unsure about the future. The primary economic challenges remaining are, as you might expect, twofold. A substantial majority of providers are experiencing lower than normal enrollment, while simultaneously facing higher than average operating costs. Nearly 3/4 of respondents indicated that their enrollment had decreased since the beginning of the COVID-19 pandemic. Included among those were nearly 90% of childcare centers and 84% of childcare ministries, which together account for about 3/4 of all community-based care provided. Those numbers echo the national landscape for enrollment. And troublingly, some studies in other states have suggested that re-enrollment to high-quality learning environments has somewhat lagged return to other settings. The rise in operating costs was equally ubiquitous. Nearly 80% of survey respondents noted increased operating expenses associated with facilitating social distancing and enhanced sanitation requirements. The added expenses were divided nearly equally across a handful of categories: cleaning and buying personal protective equipment, additional purchase of individualized materials or equipment for the children that we serve, and staff augmentation needs. A smaller but still notable percentage went to addressing rising benefits costs and mental health services. Although many providers are now operating below their break-even point, fewer than 1 in 10 providers statewide have raised their rates to compensate. We understand that families are more price sensitive than usual and may simply opt out of care, particularly if they're working from home or if they're out of work entirely. The Urban Institute compiled a summary of 88 childcare-related surveys administered since the beginning of the pandemic. Obviously, this topic's been on not just our minds, but a lot of minds. In its Picking Up the Pieces plan issued late last year, Childcare Aware of America noted a number of themes cutting across these survey responses, including that parents are afraid to send their children back to care, that they're struggling to find a childcare situation that enables them to work in their new reality, and that they're unsure whether their prior childcare arrangement will remain viable at the end of the pandemic. While the story of COVID-19 is very much still being written, the evidence is stacking up that the influence on the workforce is profound and that it is disproportionately impacting women. Another lens of this challenge portends even longer term implications. And this is the one, of course, that concerns us most. As widely noted in September of 2020, as schools returned to session nationwide, many kindergartners were simply missing. In a recent Education Week Research Center survey of 500 district leaders and principals, more than half noted a decline in kindergarten enrollment. So too in Indiana, where On My Way pre-K enrollment lags 2019 numbers by close to 40%, reflecting parental choices to keep children out of congregate settings of learning. The benefits of participating in high-quality early learning experiences are well documented. We will have work to do to make up for this loss for years to come. The important work of those on this call and others then is to ensure a network of thriving, high-quality early learning providers stands ready to meet the need. So what then must we do to deliver on the urgent task at hand? Importantly, Indiana is off to a much better start than many other states as a result of three primary factors: early and extraordinary state intervention, wide availability of federal funding, and unprecedented philanthropic support. Indeed, more than 8 in 10 Hoosier providers have indicated that they've received pandemic-related assistance through public and philanthropic sources. With an astounding $25 million in support from the Lilly Endowment, Early Learning Indiana is proud to administer one of these efforts, the Come Back Stronger Fund. In our first round of funding, we supported more than 1,000 providers in 81 of Indiana's 92 counties, with more than $13 million. Through this round, Eli partnered with nearly 2/3 of all high-quality providers statewide, who together serve fully 80% of all children enrolled in high-quality care. More than 60% of awardees met our design criteria for serving large numbers of vulnerable children, so we were glad to have extra emphasis there. We're currently accepting applications for a second round of funding, so if you're a provider on this call, we'd love to hear from you. Together, the actions above have established an extraordinary foundation for our continued efforts to rebuild the early learning sector, but they are just the beginning. This is a target-rich environment, and others will no doubt make other suggestions to protect and advance this vital work. We are anxious to hear them. To start the conversation, I'll share a few elements of Early Learning Indiana's roadmap. First, to continue our work to come back stronger, so to speak, we must begin by securing the financial viability of the early learning sector. While this is a necessary step, it is far from sufficient. We must quickly refocus our attention on delivering the quality learning outcomes that have understandably but disconcertingly taken a back seat to health and safety measures in recent months. Finally, we must plan for our future by accelerating our efforts to recruit and retain an effective early learning workforce that is designed to deliver the learning outcomes that we all desire for the children that we serve. If the foundational priority is to ensure the stability of the supply of high quality early learning opportunities, we have to confront some hard truths. In too many conversations that I've participated in over these past 3 years, I know that the inquiry often ends with the truism that there aren't sufficient public dollars supporting early education. We should continue to make the case that high quality early learning is among the worthiest of public investments. But there is plenty for us to do while we make those inroads. First, we should consider the manner in which we're spending all current public dollars and look for opportunities to target our investments to better reinforce our public policy goals. This review should be undertaken with an eye towards innovation and a recognition of the unintended consequences that are baked into the current recipe that we've all come to accept. Second, we shouldn't let our industry off the hook for addressing certain long evident opportunities. The chronic fragmentation of the early learning industry leads to operational inefficiencies and creates a navigational challenge for families seeking care. It's also deeply isolating, with too few opportunities to learn from one another or join forces across organizations toward collective improvement. Lastly, our industry is slow to adopt new technologies that could improve the family experience while optimizing our operations. Providers recognize these challenges. In a study we commissioned in 2020, providers identified a wide range of operational opportunities that they face, with approximately 40% identifying the need for financial management and facility support, and nearly half citing the need for better HR management. To start to address these gaps, with the support of Lilly Endowment, Early Learning Indiana recently launched our Stronger Together initiative, designed to encourage early childcare and education providers to work together and with other community stakeholders to form regional collaboratives intent upon lowering operating expenses while maximizing available revenue. By investing in technology, sharing substitute teaching pools, entering into bulk purchasing arrangements, and undertaking similarly focused efforts, providers can gain the benefits of scale while maintaining the advantages of independence. Through our own 8 centers, Early Learning Indiana has learned a great deal as we've worked to set the example for this kind of initiative. In 2020, we launched Salesforce as our child care management system, which is now helping us monitor and predict upcoming classroom openings to refill our high quality seats as soon as possible. Now we're leveraging what we've learned in our plans to help the rest of the state by launching a marketplace that will bring early learning providers and families in need of care together in a streamlined way. More to come on that. These public policy and operational challenges, along with targeted investments in increasing capacity for hard-to-serve populations like infants and toddlers, are critical to ensuring a viable early learning sector. Of course, these efforts to strengthen financial sustainability must be matched with equally robust efforts to continue to improve the quality of the learning outcomes achieved through our work. Though the number of providers reaching the quality benchmark under the Path to Quality system has grown precipitously in recent years, there is some evidence that Path to Quality is approaching a saturation point and has certain other limitations of design that we should consider. Indeed, the state of Indiana's Birth to Five strategic plan, which was completed in 2019 before any of us knew what COVID-19 was all about, recommended building upon Indiana's definition of high quality and updating Path to Quality to link quality standards to outcome-driven measures. While available evidence is very limited, a recent pilot suggests that our own high-quality day early learning centers aren't fully preparing children with the fundamental early learning and math skills required to support their success in kindergarten and far beyond. We know that we are not alone. Eli has studied the national landscape of quality rating systems and examined the excellent data-driven quality improvement strategies being undertaken by 4C in Evansville and in pockets elsewhere across the state. We are now seeking to reframe our understanding of quality with a focus on instructional practice and the resulting learning outcomes. Again, through the generosity of the endowment, in the coming weeks, we will be launching a statewide demonstration project in partnership with the National Institute for Early Education Research that is designed to monitor objective measures of quality through the adoption of new evidence-based assessments. With data in hand, providers will be better positioned to target improvement efforts, and policymakers will be enabled to further prioritize their investments. If you or a provider in your community would like to join this coalition of the willing, please reach out to our team. Importantly, state policymakers have embraced these initiatives to refine our thinking and are closely monitoring these efforts to inform the next generation of quality for years to come. This renewed focus on quality will no doubt increase the already significant pressure on developing a high caliber early learning workforce. I'm told by our team that we haven't experienced a recruitment challenge like the one that we currently face in recent memory. Understandably, much attention is given to the importance of high wage, high demand careers. We would do well, however, to spare a thought for those high value careers without which our economy cannot flourish. Early learning is, of course, one such career. Undeniably, the very financial model on which the childcare industry rests poses a significant challenge to attracting and retaining a high quality workforce. To the extent that the overall pool of resources will not grow substantially in the coming year, then, we must consider distributing that pool differently to produce better learning outcomes. At Early Learning Indiana, we believe that those changes must begin with the educator preparation process itself. While pursuit of a bachelor's degree remains an important pathway for early learning careers, it is simply out of reach for many of our workforce, including those who are working in this industry perhaps on a temporary basis on their path elsewhere. With the support of Richard M. Fairbanks Foundation and others, Early Learning Indiana is creating a series of competency-based, job-embedded preparation programs designed to lower the cost of training while accelerating time to productivity and improving learning outcomes. Our first program in this series, built for classroom support professionals who constitute the highest segment of turnover in our field, is in the pilot in our centers right now as we speak. We look forward to opening up training opportunities to other Central Indiana providers later this spring and ultimately to the state at large. Next, we'll turn our attention to securing the right partner to help build out our alternative pathway for classroom teachers. Additionally, we must continue to pursue initiatives to deepen and widen the candidate pool. Recently, we partnered with Educate Me Early to attract men of color to the early education field and launched a sabbatical program in an effort to create the occasional summer off to better mirror the opportunities available to teachers in K-12. We recognize that we have to keep adjusting our practices to make early learning roles as attractive as possible to a large and diverse field. Finally, like many industries, lack of professional growth opportunities drives our best teachers outside of the classroom to take roles with more flexibility and compensation, such as in licensing, center leadership, or out of the field entirely. We are currently launching career pathways that enable teacher leaders to expand their reach and grow their compensation while keeping a majority of their time and talents invested doing the work that they do best and that we most need them to do. We're looking forward to helping other early learning providers replicate these pathways in their settings. Success in these and other experiments happening around the state will be critical to ensuring that this workforce, which COVID has taught us is truly essential, can deliver the long-term gains for children that we know are possible. It has been our absolute honor to work alongside so many of you on this call as we carry out these priorities. For those of you who are new to the issue, we welcome your involvement. Consider joining the Early Education Works Coalition, led by United Way of Central Indiana, with participation from corporate partners, community organizations, and others advocating for change. If you have extra time, once COVID restrictions are lifted, volunteer at a center in your community to witness this important work up close. And as many of you have already, if you are able, consider supporting a family's journey to self-sufficiency by investing in high-quality learning opportunities for their young children. In closing, I'll just note that while more is known now about the scale and duration of the COVID-19 pandemic, its ultimate impact on young children and their families is as yet challenging to quantify. What seems certain is that vulnerable families and indeed whole communities struggling to rebuild are going to be more reliant than ever on high quality early learning opportunities, both to stem the tide of learning loss and to return to economic stability. The changing Indiana landscape in recent years has proven that while the barriers surrounding the early learning sector are intractable, they are not immovable. Together, we can pursue the rare strategy that promises multi-generational impact. So with that, I'll invite your questions and look forward to continuing this conversation with you all in future settings.
Great, thank you, Maureen. We do have one question. What do things currently look like in early learning centers with the COVID-19 pandemic?
Yeah, it's a great question. If you haven't taught in an early learning center, then you probably haven't been in an early learning center recently, because one of the big changes is that we have really limited the traffic flow in and out of centers. And so what you might notice first is that family engagement happens truly outside of the building in most cases, and certainly that's true within our own day early learning centers. So we've had to get creative about how we connect with families and find out whether that infant had a rough night last night, or what other situations might befall a toddler. Once inside a center, the changes that you will see are things like greater social distancing. In the early learning setting, we talk about airplane arms so that children have some helpers and how they stay apart from one another. And we do our best to enforce that. When I've been asked this question, I admit readily, social distancing of 6 feet does not happen perfectly in the early learning setting, but we're always striving to do all the things that we can structurally to enable that. The other very big change that is challenging for us as providers is that we no longer combine classrooms. So if you've had early learners, you might know that at the beginning or end of the day, children come together to kind of wait for their parents. And at that time of day, we tend to let teachers go, and that is one of the ways that we make our care affordable. We're unable to do that right now. We have to keep classes in distinct groups and walk children back from the front to the back of the building. So that separation is a real difference as well.
Great. We have a question from Courtney about the shared services work that is underway, especially sub-pool supports. She says she would love to hear more about that.
Yeah, so we really believe that the people closest to the work know the most about the work. And so what this Stronger Together initiative is, it's a regional model that allows communities to come together based on the distinct needs of that community and to serve their families and providers as best as they are able. And so we think a joint subpool is a great one that we would expect to see in a number of the applications that are due here in the next handful of weeks. because we know that that staffing challenge is it's seemingly endless, isn't it, for those providers on the call? I know it certainly is for us, with 5 a.m. phone calls of, especially now, I have a little bit of a fever. I might have come in a year ago, but now I know that I shouldn't. And so we think those innovative staffing strategies like a joint subpool are going to be critically important for the way forward.
And there's a couple of questions about the assessments you talked about. Can you talk a little bit more about the statewide assessment pilot and how programs and communities might be involved? And I guess in addition to that, yes, just another question along those same lines.
No, that's great. Almost. So we are working through the final details with near the National Institutes on Early Education Research. We are almost there, and then ready to share out more information. And we'll put out a webinar and other ways that those who have an interest can get engaged. So watch our website for that information. But really, the crux of what we're trying to accomplish is to help us all understand how are we doing in terms of delivering on the child development and learning outcomes that we're after. And we have some evidence, we have bits of understanding about that, but I think we all wish that we knew more and had more data to drive our decisions. And so that's really what that demonstration project is all about. So stay tuned. I promise there's lots more information coming your way in the next few weeks.
Great. A question says, have you noticed a difference with economic backgrounds and students returning during the pandemic?
Oh, interesting. For our case, we serve a wide mix of socioeconomic of children across the socioeconomic continuum. And so within our own day early learning centers, we serve about 60% of the children that we serve are receiving either public assistance or tuition assistance, for which we fundraise, and the other 40% are private pay. We have healthcare workers, we have early Head Start families, we have the whole of America within our centers. And I think what we found is that the return has more to do with the role of the parents, and certainly the essential workers never really left us. For others, I think families who are able to work from home, we see them doing that in many cases. So I would say it maybe has more to do with the job itself than any other factor.
Okay. Sarah asks, can you talk more about the study on learning outcomes?
Sure. So that relates to that. Well, and I wish I could ask Sarah a question. That's the problem with these kinds of settings. If we were just here in the room, I'd say, Sarah, tell me more. So we did, and you'll chime in again through the chat if I don't have this right, but we participated in a pilot of learning outcomes that were just evaluated in a handful of places. And we looked at two categories that we know are critically important. We looked at early math and early literacy. We do other things to measure how well we are achieving on the social emotional skills that we know are vital as well. And what we found is that there are things that we do very well. We were very surprised to learn that our children are expert rhymers. Who knew? But there were a lot of other areas that we continue to have work to do. And so I know that all of us statewide are going to have access to data through the kindergarten readiness indicator later this year for at least those 4-year-olds. But part of our demonstration project is to understand what else can we know that are early indicators, so that what can we know about a 2-year-old or a 3-year-old that might change our course and how we serve that child to make sure that they're ready for kindergarten when the time comes.
Outside of the COVID-19 pandemic, what is the biggest challenge facing the early learning sector?
Yeah, great question. It's funny, we weren't lacking for things to do, were we, pre-pandemic? I think that the fundamental challenge is one of making sure that we do have the quality in instructional practice to give those learning outcomes that we're all after. But I think the precursor to that, and the problem that we must solve if we're ever going to get there, is really the issue of staffing and making sure that we have And, you know, first and foremost, the people, which right now is a real challenge, particularly for infant and toddler care, but also that those people are skilled in the right ways to be able to help all children achieve at their highest levels of potential.
One more question. So if you have any others out there, please ask them now so we can address them after this one. What are you most excited about in the early learning sector ahead?
Yeah, great question. You know, I think these are really hopeful times. I think more than anything else, I am excited about the alignment of interests. You know, all of a sudden we understood that K-12 schools also have an important function in childcare. And I think pre-pandemic, we kind of ignored that. We wanted to separate those two things, but they go together in certain ways. And I think that as the universe has understood that about K-12, it might help understand a little bit better about early learning and what's happening in the lower levels, because it's the exact same. Of course, an important component of it is just the care and safety of children, but you cannot disconnect that from the learning that's happening in this environment. So I'm excited about that new understanding and the opportunity we have to build upon that with a lot of stakeholders involved, and many of whom are on this call.
Okay, wonderful. We haven't had another question come in, so I'll give it just another second. And while we wait, just a reminder that this event has been recorded, and we will be sharing that recording out via email as well as on the Early Learning Indiana website, which is earlylearningin.org. Oh, we do. Okay, here's a question, and this is related to the Educate Me partnership. One is a kudos for engaging more Black males, that representation matters. Thank you. Related to that, Sarah says, are there other areas where equity is being thought about more intentionally in the early education space?
Yeah, it's a great question. I think right now, and Child Care Aware of America and others are, I know, very, very focused on this issue and helping to bring more understanding to our whole field around this. I do think, you know, in some of the work around learning outcomes will help us understand too if there are disparities that are being created in the earliest of years. I can say within our own early learning centers, as we looked at the data, some, you know, disaggregated groups of children did better in some categories and others in others. There wasn't a kind of clear racial line, which is terrific to see. But there were disparities throughout that we need to understand and build our training around. I do think that it's really important that our workforce is reflective, and that's from leadership on down of the families that we try to serve. And so I think there is much more work to do, particularly in early education leadership roles, to make sure that all children are well represented, because we know those are the children that we're serving across our field.
Right. Regarding legislation, we are in the middle of a general session. Is there any legislation we need to be aware of in regards to early learning?
Great question. I wonder if my friend Ann Valentine might chime in from the United Way. She has been in the leadership role, so we'll look to her for that.
Can you hear me? Am I good to go? Really, there's just a handful of bills that have been introduced that would touch early childhood education. And most of those are really in the weeds sort of things. The one that the FSSA's office is pursuing is around being able to email a particular set of information that previously had been required certified mail. Another sort of an outcome of the pandemic being that was not a feasible option for delivering information to providers. Others related to that have to do with sort of the connection between the governor's executive orders and the emergency declaration, and to allow entities like the YMCA to bring children in a way that they hadn't served children prior. Needed some flexibility around approvals from the state, essentially. And they had to have both the emergency declaration and the executive order from the governor. And there are two pieces of legislation that would say once an emergency declaration like that is made, that allows for that flexibility with the agency. You don't have to wait for the second thing. We, as Maureen mentioned, we lead the Early Education Works statewide coalition. And a year ago, we had big grand plans about all the things we were going to ask for during this current legislative session, and decided over the course of the year that we just wanted to focus on ensuring that the state continued to invest in On My Way Pre-K. And we're asking legislators to contemplate a slight increase in the On My Way Pre-K funding. And really more focused around how many children are served through On My Way Pre-K, looking at 2019-2020 as the baseline for enrollment. When you factor in all the children served through On My Way Pre-K plus the Indy Preschool Scholarship Program, the state, that public funding was serving around 4,100 kids, and we think we should go to 4,500. So just a small increase in the number of children served. And we have some advocates within the legislature who are carrying that call for us. We are also asking of others. Some legislators are a little more enthusiastic, and others, the chairman of the House Ways and Means Committee gives you nothing when you meet with him. Like, it's like, very nice information, which is his job, right? You wouldn't expect anything else, particularly in when the state's facing some financial challenges. That we were encouraged by the financial outlook that came in December, that might be a little more receptive to that. And the good news is that the governor's introduced budget keeps it at level funding, $21 million allocated for On My Way Pre-K, some of that in reserve funding, and $18 million in state funding each year of the biennium. So that's a great place to start, is the approach that we're taking. Was there anything I missed, I forgot, Maureen,
No,
that you?
no.
Thank you.
We should always be able to phone a friend on a webinar. I love it.
I'll go back into hiding.
Thanks, Anne. The last question we have, Maureen, is related to the Fast Track CDA program you mentioned that Early Learning Indiana spearheaded early in this pandemic. Could you say again the results of that, and
Sure.
will there be a second Fast Track CDA opportunity?
Sure, absolutely. So we started looking around early in the spring, and we had to move people out of our classrooms, either because they were in a high risk category, or frankly, we just didn't have that many children that we were serving. Typically, we serve about 800 children. At one point, we were serving about 125-ish a day. And so we had a lot of teachers that through some supportive funding from the state of Indiana, we were able to keep employed for that time, which was really, really incredibly important to not just us, but all providers. And so we thought, how can we make the most of this time and take advantage of that opportunity? And so we launched the Fast Track CDA program with some supportive dollars from the Lilly Endowment. And I won't get the numbers right if I try to give them, but we got dozens, certainly, of people through that program who were able to achieve a CDA sort of through the early days of the pandemic. And so we are really anxious to continue to support cohorts of teachers through all sorts of pathways, and are anxious to continue that work. And so you can expect additional CDA opportunities, other higher ed, and then our other alternative pathways as well. We think it's critically important.
Wonderful, thank you. Okay, well, that brings us to the end of our questions that we have received. Thank you so much. If you do have any other questions and you type those in, we will reach out to you with answers directly after this webinar. And we just thank you all so much for joining us today. Maureen, thank you for your time and your remarks and your insight into the state of early learning. So insightful, and there's lots of great things to come. So we thank you all for joining us today. Have a great rest of your Tuesday.
Thank you all. Take care.